Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. The FDA has approved Pfizer's coronavirus vaccine for adolescents. The emergency use authorization will now cover children ages 12 to 15. This means millions of kids in the U.S. could soon become eligible to receive the shot. That is, if the Centers for Disease Control and Prevention signs off on the decision. The news comes as most states are reporting a decline in cases, but experts warn slowing vaccination rates could hurt those recovery efforts. The U.S. is now averaging less than 2 million shots a day. Nearly 35% of the population is fully vaccinated. Meg Oliver begins our coverage in New York City.
Tonight, the FDA has just authorized Pfizer's vaccine to be used in children ages 12 to 15. A CDC advisory committee is expected to vote on Wednesday to give it the final green light. It means vaccines could soon reach nearly 17 million new arms in children as young as 12. And while some parents are hesitant,
for my children, great immune systems, healthy, and we don't know what the vaccine does yet.
some are not. 3 of this father's children have already been vaccinated. His youngest is 15.
A lot of peace of mind, a huge relief, to know that there's something out there that can protect him and all of our kids.
We have to engage parents in the fact that vaccines are a safe and effective way to prevent that infection and help keep our whole community safe.
The debate over vaccinating children comes as infections in kids are up 4% in the last 2 weeks, making up 24% of new cases, while adult cases are plummeting. Dr. Anthony Fauci says mask requirements may soon be relaxed, but public health officials also say the easing of rules depend on enough people getting vaccinated. In a recent study by the Kaiser Family Foundation, nearly a third of parents of children 12 to 15 said they would get their kids vaccinated as soon as possible. Almost half would either wait and see how well the vaccines worked or would comply only if it's required by schools. But nearly 1 in 4 said they would definitely not vaccinate.
What are you encouraging your patients to do?
I'm encouraging my patients to get as many family members vaccinated against COVID-19 as possible.
Today, New York's governor offered a new incentive to get people vaccinated. Starting Wednesday, they will open up 8 transit sites across the city for 5 days, like this one here at Penn Station, for walk-up, one-shot vaccinations in exchange for a free subway pass for a week. Elaine?
Meg Oliver, thank you. For more, let's bring in Dr. Jessica Shepard. She is the Chief Medical Officer at Verywell Health. Doctor, thank you so much for being with us. I know that you were listening along as we were. We just saw the FDA authorizing that Pfizer vaccine for children aged 12 to 15. How has the coronavirus affected this age group, and how significant is this move by the FDA?
Now, hearing the presser and being a part of this relevant news, which was just, stated today, these are the kind of changes that we need to see when it comes to vaccination and the distribution, especially with our younger population. Now, over the course of the year, we've really had to change a lot of the school travel recommendations for families, also because of younger children and the possibility of them getting COVID. So these are the changes that the FDA anticipated, and from the studies that were done by Pfizer, the trial really looked at what doses would be needed, what complications might occur, and taking the steps necessary in any trial to make sure that the population that it would serve has the best outcome when we think of vaccination.
And Doctor, what needs to happen before this age group can actually start getting vaccinated?
Now, what that means is we've seen now that the study has been approved, the FDA has approved this vaccination. It really comes down to communication and also distribution of the vaccine that's needed for children aged 12 to 15. Now, again, like we've seen in adults, getting those vaccines to the people who are going to be most at risk, this will also play a role in getting those to children, making sure that the children who might be at most risk, depending on any comorbidities, we make sure that those children get those first and then distribute as needed.
Before we move on to the rest of the conversation, I do want to ask about something that my CBS News colleague David Begnaud brought up during that news conference. The last question there about when these shots might be in pediatricians' offices to be given out there. And the answer, doctor, I just want to make sure I'm clear. It sounded to me as though because of the storage that's required, Pfizer needs to be stored at an incredibly low temperature. It wasn't necessarily going to be available there first. It sounded like pharmacies are the places where people should go if they're looking to get their children vaccinated. Did I hear that correctly, doctor?
From what I heard from the presser as well, that's what the information sounded like to me. The most important part, because there is refrigeration that's necessary, is to make sure that the batches that need to be delivered to whether it's a state and or city is making sure that the requirements are going to be met in order to preserve that vaccination, in order to get them again safely to the population that it's needed for. So that's one of the distribution queries that need to be made as far as where it's going and who's going to man that supply, and also be prepared to facilitate the refrigeration of those vaccines.
Taking a step back, President Biden wants 160 million people fully vaccinated by July 4th. We're more than 44 million away from that with 56 days to go. Given the slowing pace, doctor, do you think that's an achievable goal? And how close would it get us to herd immunity?
Absolutely. These are numbers that should be looked at because we have seen a slight decrease at a peak on April 13th of 3.4 million that were being vaccinated per day, down to 2.6 million a day. We have seen a shift. Now that, again, comes to actually positive feedback from vaccination, where people think that because we've reached such high numbers that there are, again, the majority of the population that may have been vaccinated. So this is where it comes down to the communication and persistence, and also making sure that the messaging that we send out is getting to the people that still need to get vaccinated, whether that has to do with access or resources. We still need to make a great effort to, again, increase vaccination news and also reassurance, and creating a sentiment that allows people to understand the importance of getting vaccinated and making sure that those people do.
Well, new data from Johns Hopkins University shows all but one U.S. state did not see an increase in COVID cases this past week. In fact, a majority of them saw a decrease. Do you think this trend will continue, and if so, why?
Well, this is, again, the positive vaccination news that we want to see and we expect as we get more people vaccinated. However, we still need to make that effort and that work towards people who may not be, because we still do have risk of transmission, even though we haven't reached that quote unquote herd immunity. We know that that can be reached, and will it be reached by July 1st? That's, something that we'll have to see. However, we do need to do the important work with making sure that now that we can vaccinate between the ages of 12 and 15, that we take that messaging and make sure that we get that population served, as well as continue to serve the population in adults that have been unvaccinated up until now.
Dr. Anthony Fauci says it may be time to start relaxing indoor mask requirements. He also said masks could become a seasonal measure after the pandemic. What's your take on that, doctor?
I think that we have seen exactly what can occur when we are hit by a global pandemic that can really shut the world down. Now, going in the future, we know that we have a virus that most likely will not go away, and we have to make some changes in our normal day life that might consider wearing masks at a certain time of the year in order to prevent transmission and increase in risk of transmission at a certain time of the year. Now, I don't think that is uncommon for us to take those measures, especially when we have seen how it can affect people who have comorbidities. And again, that risk of mortality and morbidity when it comes to COVID-19, we have seen that there have been some variants in the virus as well. So those, again, are things that we would have to anticipate and follow the science and data behind COVID-19 and what can occur in the future and what steps we need to take in order to be preventative.
Well, similarly, the former head of the FDA, Dr. Scott Gottlieb, says state and local governments should ease restrictions on indoor gatherings as more people get vaccinated. Do you believe it's safe to do this, especially if we also ease mask requirements?
Well, the point is really to get to a state of normalcy again, and what that might mean is maybe some different parameters than we've seen pre-COVID. However, we do need to, again, I guess, test the waters and see what those changes might be in order to get to that state of normalcy. Now, again, we have lifted the mask requirement for outdoor settings, but now that we have seen a decrease in vaccination, we may need to wait until we increase those numbers again, get to that level of herd immunity before we start to make recommendations for indoor settings, because we know most risk of transmission occurs in an indoor setting rather than outdoors.
Finally, Dr. Anthony Fauci says when it comes to India and the situation that's developed there, it has, quote, got to shut down, is what he said. The country is dealing with a crippling outbreak. Is that the only way, doctor, to get control of the virus there?
Absolutely. We know that this virus has a very high transmission rate, again, with people in close quarters. And so with a country that has a very high population, we know that that risk of transmission is going to be even greater. So we have the steps. We've seen, again, over the last year, how many countries have dealt with decrease in transmission of COVID-19, and a shutdown would be appropriate at this time for India in order for us to see a decrease in mortality and, again, to contain the virus and the spread of it.
All right, Dr. Jessica Shepard. Dr. Shepard, thank you very much for sharing your expertise with us.
Thank you so much.